Join us here on the Splash Live to debunk some type of rumors that we may hear about different screenings with lung cancer. We have from the Henry Ford West Bloomfield Hospital, Dr. Ikenna Okereke, MD, join us. Appreciate your time for joining us, doctor.
Hey, how are you? Thanks.
Absolutely. So we're talking about an article from yahoo.com. Fewer than 1 in 5 eligible Americans are getting the recommended lung cancer screening. You specialize in lung and esophageal disease. What did you have to say in regards to that article?
Yeah, so in fact, that's an overestimate. Yeah, we do very poorly when it comes to lung cancer screening in this country, in Michigan, in the region. So a few years ago, it was determined that if we screened people between the ages of 50 and 80 with some smoking history, I can get into details, but if we screen those people, we could save lives. And yet across the country, only about 6 to 7% of those people who should be screened are screened. And screening is just a CT scan of the chest.
Wow. So let's get into who should be going for a lung cancer screening and when should you do this? Should this be all Americans?
Yeah, very good question. So as I said, if you're between the ages of 50 and 80 and you have a certain pack year history, that's 20 years of smoking at least 1 pack a day, or 40 years of 0.5 packs a day. You do that math to get to 20 pack years. Those patients should get yearly screening CT scans while they're in that age range of 50 to 80.
Interesting. So we are talking about maybe the older population and demographic, not necessarily the younger adults and things of that nature. So thank you for clarifying that. And what about the non-smokers, I should say? In what ways do environmental, genetic, or even like lifestyle factors affect or contribute to lung cancer in non-smokers?
That's a fantastic question. That's the emphasis of some of the research that we're doing here at Henry Ford in Wayne County and surrounding counties. So we have seen that roughly 15 to 20% of people nowadays who get lung cancer are lifetime never smokers. And so for us, we looked over the last 40 years at never smokers in Wayne County to see who gets lung cancer. Well, if you're never smokers, and where do you get lung cancer? And what is interesting is that there were specific clusters and they correlated to the most polluted areas in Wayne County. So to your point, there are probably environmental, maybe even occupational factors which contribute to the development of lung cancer in smokers and non-smokers.
Wow, that was very interesting. To even hear about non-smokers being affected by lung cancer is kind of a scary situation, a cost situation. Joining us here on the Splash Live, talking about lung cancer screening, we have from the Henry Ford Hospital West Bloomfield, Dr. Ikenna Okereke, MD. Just talking about a little bit more about people who should be getting screenings overall, and the education behind lung cancer screening. Speaking of education, how do you feel our healthcare providers play a role in educating us in lung cancer screening?
So what I try to tell people is that, as I said, getting a CT scan is fairly easy. It's fairly non-invasive. The amount of radiation exposure from the specific type of CT scan we give for screening CTs for lung cancer is minimal, very low amount. So really, as you say, it's really the awareness. And what can we do as providers to make awareness the public? And I say that really should be everybody, not only the surgeon, primary care, pulmonologist, but really anyone who is a caregiver at whatever level should consider there's such a low rate of lung cancer screening, and we know that it saves lives in this specific cohort. What can we do to increase that rate? And to your point, most people in the community don't even know the criteria, the guidelines, the safety. And so it really is, what can we do to overcome that obstacle and that gap in knowledge base in the community? And I think it's everyone's job.
No, absolutely. I would like to say so too. It's about awareness first and foremost. If you're not aware of it, how would you even know, how to tackle it in general? And then being able to openly talk to your healthcare providers and for them to provide the information and the resources goes a long way. Doctor, we appreciate your time here. Before we go, any additional important information that we should know right here in the Greater West Bloomfield area about lung cancer or lung cancer screenings?
I think most importantly, as I said, get the CT scan if you're in that criteria group, both on age and the amount of cigarettes that you've smoked. And I know some people have some fear of the unknown. I get the CT scan and it might lead to a diagnosis, but it's always better to know than not to know. So there is some fear, there is some mistrust, medical mistrust. It's probably warranted in the community. But I would say to anyone who's listening, if you're in that age range and you've smoked, get the CT scan. It's better to know than not to know.
That's a great point. That's a great point. Thank you again for your time from the Henry Ford Hospital, West Bloomfield, Dr. Ikenna Okereke, MD, talking about lung cancer and lung cancer screening, Greater West Bloomfield area. Thank you again for your time.
Thank you, Kevin.